Hello, I am introducing BIPAP machine, which stands for bilevel positive airway pressure. These machines are non-invasive ventilation devices that help patients breathe more easily. They are commonly used for people suffering from conditions like sleep apnea or respiratory failures, and for those who have trouble breathing properly. Unlike CPAP, which provides constant pressure, BiPAP delivers an air at two different levels: a high pressure during inhalation called IPAP and a lower pressure during EPAP. These machines, BiPAP, and more advanced and comfortable option for many patients. This image shows how a BiPAP machine works. The patient is wearing a sleep mask connected to the machine through a tube. The BiPAP machine gives two levels of air pressure. Blue arrows show a high pressure during inhaling, and red arrows show the low pressure during exhaling. This helps to patient breathe more comfortably, especially during sleep. Okay, in this slide we discuss about principle of operation. BiPAP work using positive pressure ventilation. This means it pushes air into the lungs through a mask to keep the airway open. It uses two types of pressure. First is IPAP and second is EPAP. IPAP helps the patient breathe in. EPAP keeps the airway open while breathing out. This helps to person breathe on their own and also support oxygen and carbon dioxide exchange. Okay, this flow diagram show how a breathing support machine like a ventilator or CPAP works. Power supply provides electricity to the system. Control system manages the machine based on sensor feedback like airflow and pressure. Pressure generator blower creates the air pressure needed for breathing. Humidifier optional adds moisture to the air to make it more comfortable. Air filter cleans the air before it reaches the patient. Patient interference mask delivers the filtered pressurized air to the patients. Sensor continuously send feedback to the control system to airflow to adjust airflow and pressure. So the mathematical model. In BiPAP, the lungs can be modeled like an RC electrical circuit. Airflow equation Qt is equals to Pt minus PATM upon R. This tells us how much air flow into the lungs. Higher pressure IPAP is equals to more airflow. Resistance R is equals to narrowed airways reduced flow. Lungs volume equation Vt is equals to C dot Pt. This shows how much air the lungs can hold. Complex tells how stretchy the lungs are. More pressure is equals to more lungs expansion. Now specifications. Modes. Spontaneous triggers when the patient breathes. ST spontaneous per time adds breakup breath if needed. Time fully timed breath useful for certain conditions. Pressure range adjustable pressure between 4 to 25 centimeter. Water H2O to suit different breathing needs. Ramp time allow the pressure to gradually increase over 0 to 45 minutes for patient comfort while falling asleep. Humidifier can be built in or optional to add moisture and reduce dryness in airways. Display acid risk screen shows settings and help with monitoring the machine. Alarms alerts for issues like mask leak, power failure, low pressure or apnea. Interfaces works with nasal mask or full face mask depending on patient preference. Data logging saves usage data on an SD card or cloud useful for doctor to monitor therapy. Okay, supply companies are international and national. International Philips and Redmond and national is BPL. This is the picture of BiPAP I captured during my visit to hospital. In In conclusion, BiPAP machines are critical for non-invasive respiratory support, provide dual level pressure to support both inhalation and exhalation, widely used in home and hospital settings for patients with breathing difficulties. Technologies advancement continue to make BiPAP machine more efficient, portable, and user friendly. Thank you for listening me.